So with that, I'll conclude, and I'll turn it over to Dr. Bruce Randolph, our health officer here for Shelby County, and then we'll be back for any questions you might have. Dr. Randolph.
Thank you, Mr. McGowan and Mr. Sweat. Greetings, fellow citizens of Shelby County. I'm Dr. Bruce Randolph, the health officer for Shelby County Health Department. And I just want to highlight a few things before we open up for questions. We're rapidly approaching the 1-year mark when we first found out that we had a case in Shelby County. And during this year, we've gone through some challenging and difficult times, but we're here. And we've gotten to a point where now we are seeing downward trends in a lot of our critical indicators. And we have the vaccine now on hand. And it is very important that we understand that we must continue the course. First, I want to just thank you, fellow citizens of Shelby County, for your cooperation and all that you have done to help us get to the point where we are at this time. I also want to just simply say that we certainly regret the unfortunate events that took place, but we're asking that you continue to support our efforts, continue to follow the safety measures outlined in the health directive, and we're moving forward. I want to make it very clear to everyone there's not a conflict between the Shelby County Health Department and the city of Memphis, as some had rumored. We are partners in this. We are working together. I'm the health officer of Shelby County, and from last that I remember, Memphis, the city of Memphis is a city in Shelby County. We are partners in this, and we're going to work together. We're going to do whatever it takes to make sure that every citizen who wants to get vaccinated in Shelby County will indeed be vaccinated. And so that's the bottom line. It's about getting the job done. And whoever can do the job best and is in the best interest of the people, that's what really matters. I want you, fellow citizens, to really hold the course. We still got to wear the mask. We still need to maintain social distancing and avoid crowds and poorly ventilated areas. Even if you've gotten your shot, even if you've gotten your vaccination, we still need to adhere to these things. And get tested. It's very important that we still need to know our status. We still need to know, especially in light of the fact that we have several variant viruses around, we need to be able to identify who may be infected with these so we can place them in isolation and quarantine at an appropriate time and as soon as possible so we can continue to avoid the transmission and we continue to make progress. Also, get vaccinated, and when you schedule your appointment, if you can try your best to keep it, but if you can't, at least let them know so someone else can get that spot. Please, if you don't make multiple appointments at different sites, because when you do that, you are denying someone else the opportunity to be able to access the vaccine. I've gotten multiple calls and complaints about the fact that as soon as the availability of appointments are posted, they are taken away. And then when we have a 10% no-show rate, then that really creates some problems for us. Last thing that I would want to just mention, and you may have heard that the Johnson & Johnson vaccine has received emergency use authorization. We don't know exactly when we will start receiving the vaccine. Mr. McGowan might know. He's been in communication with the state. But one of the things that I want to say about this vaccine, and there'll be more as we learn more, is that it is a different vaccine. It's not the same as the Pfizer and Moderna. It is easier to administer in the sense that you don't have to be so concerned with maintaining the temperature as you do with the others. And even though the efficacy is less than that of the others in terms of moderate infections, the key component and the main reason why you vaccinate anyone is that we're trying to avoid deaths. And this particular vaccine is 100% effective in preventing deaths, just as the Pfizer and the Moderna, and it is also 85% effective in preventing the severe and critical cases of COVID-19. And that's the ultimate goal, is to keep people from being sick and requiring hospitalization, and of course, avoiding them from dying. And the beauty of this particular vaccine is that you don't have to worry about a second appointment. It's one shot and that's it. And this would allow us to offer the vaccine to more people and get our people vaccinated at a quicker time.